Most of the time, patients that have diabetes, depending on how long they have diabetes, end up with loss of sensation, which is a loss of feeling. Usually occurs around the toes and spreads approximately up to the ankle or leg. That's the main cause at times for ulcerations, or which is the first indication of ulcerations, is people that have they have loss of sensation on their feet. Usually, these patients are at least 2 times more likely of developing an ulceration. Another thing to take into consideration is not only loss of feeling or loss of sensation, is also foot deformities. A lot of people could have hammer toes or a bunion, which could lead to pressure areas. And when the patient has loss of sensation, has a deformity, it increases pressure around these areas, which could lead to an ulceration. So these are the main risk factors for a patient that could lead to a diabetic wound, which eventually will lead to infection or an non-healing wound or gangrene. A lot of times, you have to link the risk factors. Patients have loss of sensation, have a deformity, and wear inappropriate shoe gear. And when it comes to inappropriate shoe gear, it just adds to it just adds pressure to the deformity. A lot of times, people like to wear very tight shoes, shoes that do not provide enough support, and increases pressure to to an area of the foot, which leads to a wound. And also activity level. People that wear the inappropriate shoe gear might be very active either at work, either play sports, or walk extensively, and which adds to more pressure and more irritation to an area of the foot, which eventually leads to skin breakdown. And after that, you have the risk factors of an amputation.